Hello guys and welcome to All About Physiotherapy. Today our guest is Dr. Genevieve DPT from CT USA. She is an athlete herself and a movement specialist. Today she'll be sharing her knowledge and experience with us. Hello Dr. Genevieve.
Hi.
So how are you doing?
Good. It's morning here, so I just got up a little while ago.
Yeah, early morning you have taken time for us. We appreciate that.
Yeah, no problem.
And what about the COVID-19 thing? Are your people safe over there?
Yeah, none of my family or friends have been affected, which is really great. But unfortunately, a lot of jobs for myself and for a lot of people I know have been affected.
Right. So now we'll be starting the question answer session. So my first question to you is, how did you develop interest in the field of physical therapy?
So for me, I'm definitely not one of those people that knew from I guess going into college that this was something I wanted to do. I actually worked in a completely different field. I went to school to UMass Amherst for journalism, and I had several editorial internships, kind of more in the fashion and lifestyle kind of arena. And then when I graduated, I got a job in publishing at Boston Magazine, and I worked in marketing and advertising for almost 2 years. When I left college, I was pretty out of shape. I had a really fun time in college and kind of did a lot of, eating and drinking. And I was looking for something to do now that I kind of had a job to kind of get back into shape. And I started running. I ended up running 2 full marathons and 15 half marathons. And I became very disillusioned with the idea of sitting at a desk all the time, and kind of disillusioned with the whole journalism communications arena, just in terms of mobility and I wanted to make money. I wanted to be successful. So I kind of started looking into what might be some other career paths with me, since I was becoming so active. And I somehow came across physical therapy, and I literally had never heard of it. And at this time I was 24. And I was okay, I have to take all of these sciences, and it's going to be 3 more years of school. Is this something I really want to do? And I just kind of decided, yeah, I want to help people. I want to make a difference. I want to do something that's a little bit more rewarding. And for journalism, I'd always loved that interaction with people, building rapport with people, the interviewing kind of thing. That's what I really love about my profession is the people, and hearing people's stories and getting to know people and really making an impact. So that's kind of the roundabout way that I ended up becoming a physical therapist. So,
okay. So tell us something about your daily routine.
So for me, I actually am kind of a hybrid physical therapist. I work 3 10-hour days in an outpatient clinic not too far from where I live here in Connecticut. It's a small, they own 10 other clinics. It's a small PT owned outpatient facility. So I do my 3 10-hour days. I do Monday, Wednesday, Friday. And then on Tuesdays and Thursdays, I work from home, and I write freelance. So I do some marketing. I've done some marketing for other physical therapy clinics. I am a frequent blogger for Oxygen. That's my always standing gig. I do athlete interviews for a small brand called The Chesty, which is pretty big in the CrossFit community. And I kind of freelance, fill in the holes with other freelance projects. So for me, that works really well because I get to have my interaction with people, and then I get to do something that's a little bit more creative. So I'm very lucky that I'm able to kind of have the balance of those 2 things.
So tell us something about the resistance band training.
I'm sorry, what? Can you say it again?
Tell us something about the resistance band training that you do.
Oh, so
Some benefits.
So I do, so I'm like a huge believer in adding resistance bands to like any kind of warm up, even with like doing your, if you're doing a regular like workout, you can add resistance bands. So so I actually have a gym here at my house. And one of the first things that we did, I was like, I need to order resistance bands. Any kind of like squatting I do, I'll warm up with like lateral walking, monster walks, putting the resistance band like around my knees and like doing squats, resistance bands for like pull aparts, biceps. So like if I want to do like a bodybuilding day, like I'll do resistance bands for bicep curls, tricep extensions. So for me, I feel like that's an easy, accessible way for people to add resistance to their workouts without having the commitment of buying a whole set of dumbbells or like just filling their house. Like especially like right now with COVID going on, people want access to things, like more things to do at home. And the first thing I say to people is like, go and buy some resistance bands, because there's like so many exercises you can do with them. Thrusters, good mornings, like lots of things I can do with a barbell, like I can do with the resistance band. So I use those to like, if I have a movement in a workout that I'm doing, or if I have like a patient that I'm getting ready to load up and see like, you know, how their knee pain is with squatting, you know, I will warm them up first with resistance bands, so that low load, high rep to kind of like get their muscles firing, get ready for the movement. I am not a static stretcher. I do not believe in that kind of stuff prior to exercise. I think dynamic movement, dynamic warm up, getting the blood flowing, that I'm like a huge believer in that. Like if you're going to be, you know, moving a barbell around, or if you're going to be, you know, doing a specific movement, let's do that movement, but let's do it like a little bit less than we're doing it in the workout.
Okay. So when someone comes to you with low back pain, what is the first thing that comes to your mind as a physical therapist?
So, I mean, I've been trained in kind of like the McKenzie way of thinking. So the first thing I do is I classify them, whether they're a flexion bias, an extension bias, or their specific exercise. So they're like hypermobile. So once I see what direction they can go in that reduces their pain, my primary concern is to get them out the door with a program where they can manage their own symptoms. So I love that that's my way of helping people, is to actually make it so they don't need me. So that first session will be to mitigate their pain and show them either let's say they're an extension bias, they're gonna lay in prone for 3 minutes, they're gonna go up on their elbows for 3 minutes, they're gonna do press ups, and they're always gonna be checking in with themselves. Like, am I in my happy place? Is my pain getting better? Is my pain getting worse? And I can't stress to them enough that these movements are something they're gonna have to do every hour, every time their pain comes on. So a lot of times what I find is people will leave the clinic and they'll feel better understanding their directional preference, but then they'll go home and they'll do the exercises like 3 times. And I'm like, no, like I literally meant you had to do this every hour. And then they'll come in and, oh, I don't feel any better. So once I can make them understand that they need to be doing this every hour and they start to feel better, then I begin to work on the muscle imbalances. So either they are like, a lot of times with low back pain, people have no hip stability. They have no core control. Their glutes are not working because they're sitting at a desk all day. So once we kind of address those things and they know like how to mitigate their pain or the directional preference, most people do really well and like don't really have reoccurrences.
Okay. So my next question to you is, why should someone go for kettlebell training?
Kettlebell training?
Yeah.
Why should someone, I don't know that someone should go for kettlebell training. I think that I'm not sure what population you're speaking to, but I think someone should do whatever is going to get them like moving around. I'm obviously from, I don't know what you know about me, but I am a huge believer in functional fitness. Doesn't have to be CrossFit. It doesn't have to be, you know, Olympic weightlifting. I just feel like whatever somebody's doing, you know, that will help them like in their life. So for me, you know, at the end of the day, I don't want to end up in a nursing home where I can't get myself up off the toilet because my legs aren't strong enough, my glutes aren't strong enough. You know, when I'm like 90 years old, I want to be functional and I want to be able to get out of bed, get in and out of my car. So yeah, so I mean, so with kettlebells, you could be doing deadlifts, you could be doing squats. I mean, I don't know if I'm really answering the question, but I think if you're using them in a functional manner, like I have a client that I train, like that I personal train as well. And, you know, we've been working together for a long time and he had to do some lifting of some air conditioners and he has a chronic history of low back pain. And because of all the squatting and the deadlifting and me teaching him proper form with these movements, he was able to do these things in his home that normally would have left him like down and out, like on his back, like not able to move the rest of the day. And that's because he has learned how to recruit the proper muscles for the movements that he's doing. You know what I mean? So, so yeah, that's kind of my feelings on kettlebell and all exercises. Like, you know, it's like if somebody wants to do Zumba, that's perfectly fine if that's going to get them moving. And the other option is them sitting on the couch. Do I necessarily think it's going to lead them down a path of, you know, lifelong longevity and fitness? Not necessarily, but it's better than nothing. So that's kind of my stance on all the types of exercise.
So we have seen many of your Instagram posts, and one of your Instagram posts was like five things that physical therapist wishes you knew.
Yeah.
So what are the five things that you think that physical therapist thinks that everyone should know?
I think that physical therapists as a whole are misunderstood and kind of underutilized, like across many different populations. So I think one of the things I said is, you know, people are going to get hurt and be drawn to the internet. They're going to WebMD themselves and they're going to try to figure out what's wrong with them. And that's great, but that doesn't replace me putting my hands on you, my, you know, 3 years of postgraduate education in terms of from a diagnostic standpoint, and also ruling out things that might be going on that could be more serious. So while I think the internet is a wonderful tool and people, you know, should use it and should educate themselves about their human body, that does not replace coming in and having an evaluation and getting a better sense of going on. So I see a lot of my patients doing that, and that's fine. But I think it's really important as a profession for us to let people know that we are the experts, and you know, we shouldn't give away information for free either. I mean, I went to school for a long time and I spent a lot of money doing it. So I think, you know, that would be the number one thing that, you know, I would want people to know. I don't think I think it's our fault too, because we don't really do a great job of advocating for ourselves. And a lot of people don't even know what we do. I cannot tell you how many times I have patients come in and they're like, oh, like, you know, did you go to college for this? Excuse me, what? Yes. Like, that's so crazy. So, so yeah, so definitely WebMDing is something that I would, you know, shy people away from. I can't remember what else specifically I said in that article. I'm just trying to think off the top of my head. I think a lot of people think pain means to stop everything. Just rest it. Just the doctor says, you know, oh, give it 2 weeks of rest. Okay, so like rest is great in certain situations, but I think continuing to figure out, like, you're going to get more deconditioned while you're resting. So then when you go back to exercise, you have the potential of hurting yourself more because you haven't really done anything to fix it. So instead of resting, being a little bit more proactive and like strengthening the tissues around whatever is irritated, so that when you go back to loading that tendon or that muscle, you know, you have a better, you get back to what you want to do sooner. Does that
Right.
make sense? So yeah,
Right.
I hate when people come to me and say, I went to see this doctor and they told me to rest for a month and I'm no better. And here I am now, finally referred me to PT. Well, you know what? That's 4 weeks wasted. That's 4 weeks that you could have been doing something to get better, to not be in pain anymore. So that really, really irks me.
Yeah, I've correlated so much with you.
Yeah.
Yeah. So my next question is, what is blood flow restriction training according to you?
Blood flow restriction.
Training.
So I have to be honest, I'm not certified in blood flow restriction training. I, have, written on the topic a couple of times. I think it is great for higher level athletes that need to return to sport. That's the most, you're in the clinic and it's busy, like you have this toolbox and you need to be able to utilize what the best things for the most appropriate patients. So for someone who's looking to return to sport faster, who's like a soccer player or a lacrosse player that has like a torn ACL, MCL, that kind of situation, I think blood flow restriction, which would be like restricting the blood flow to the tendons, which basically causes a pooling, and then you let the blood go, and it creates a therapeutic effect of this huge rush of nutrients that can help stimulate the healing process. Do I think it's for every, like an 80-year-old man who, has, tore his ACL somehow, or, got into a car accident and has like a PCL tear? No, I think it's, definitely for those higher level athletes, definitely college Division I. I see like Division I lacrosse players, that would be best for them. But I personally don't do it. I've, have looked into getting certified for it. It's just my clinic feels that the equipment is so expensive and the population that would be using it is so small. They're not like really super open to it. But yeah, I do a lot of dry needling, but not blood flow restrictions. So as I understand it, those would be the kind of populations, if I were to get certified, that I would focus the treatment on.
Okay, so my next question to you is, why women should be lifting weights?
Oh, I mean, I could talk about that for 50 minutes. But I guess what I can say, so I think women have a really poor understanding of how the body kind of, they have this idea of what they want to look like, and they don't understand that in order to be toned or to have this certain kind of physique, you actually need to load your muscles. And a lot of women, and I think we're kind of coming away from it now with everything that's been going on with the age of CrossFit and Instagram, and more women showing that they can be strong, getting bulky. So like women don't want to get bulky. So it would be very difficult for me. Like I am a moderately strong human being. It would be very difficult for me to get bulky. Like I would have to eat. I would be eating all day long, lifting weights. Like it would be a huge dedication and process for me to get that kind of bulk look that women are afraid of. It's not easy. So I think there's a lot of stigmas and stereotypes because of what we see in the media, in fashion magazines, in women walking down the runway, that create these unrealistic images of what that we are supposed to look frail, and we're supposed to be waif-like, and we're supposed to be small, and we're supposed to be quiet. And I think lifting weights is not only amazing for your body, because obviously the more muscle mass you have, the better your metabolism works. So who doesn't want to eat more and like still look good? I mean, I'm for that. But it's like, it's also like from a mental perspective, like I think just so much confidence and so much more just like sense of self is gained from just kind of lifting heavy weights. Now, am I saying that someone who has never lifted weights should go and deadlift, 200 pounds? Absolutely not. It would be a process. So, when I first started CrossFit, I could barely, you know, snatch a barbell, which is 35 pounds. And, you know, after 7 years, I can snatch 135 pounds safely. You know what I mean? But that process and watching my body change and just how much growth I personally had from that, and how much more, how much easier it is for me to do everything. And like, you know, I don't have any pain. Like I don't have any back pain. Like I don't have any pain whatsoever. I just think I can't even, if I care about someone, I want them to lift weights, because I just feel like it makes you feel so good, and it changes your whole body composition. And I just feel like it's kind of been misunderstood for a long time for women. And I'm so happy that that conversation is changing, because it's just, you know, I want my daughters, or if I have a child one day, to feel good in her own skin and not feel like she has to diet or or get an eating disorder, or, you know, feel bad about herself because she doesn't have a thigh gap. Like, it's just, I don't want anyone, you know, I don't want my children to feel that way, because I know, like, I have felt that way before, badly about myself. And I just think, you know, a lot is to be said for being able to move shit around. I don't know. I don't know how else to put it.
So one thing that you would want to change in the physical therapy practice?
Oh, one thing? Oh, man. There's a lot of things. I mean, you know, I have to be honest, with the rise of this pandemic and seeing how my company, and, you know, I'm not trying to talk bad about anyone. I don't think anyone's really known exactly what to do in this situation, but, you know, I personally took a voluntary layoff because my company, you know, just to be honest with you, was not taking people's temperature. They were not giving us the appropriate protective equipment. They were not like maintaining 5 people in the gym at a time. And, you know, they were also trying to give me new patients that I didn't know where they had been, where they had traveled. And, you know, I have to think about my own family and, you know, what I'm bringing home. So I don't think the APTA did a great job of setting any guidelines for what this is supposed to look like. As far as I'm concerned, I don't work in a hospital. Nothing I'm dealing with is life and death. I mean, I definitely see post-surgical people who need therapy. I definitely see that. But I also see people who, you know, have wrist pain from playing tennis. To me, that's a luxury. Like, you don't need to be here. Like, we have a pandemic going on. Like, please stay home. You know what I mean? Like, I also saw people in the clinic that were, you know, 80 years old. And, you know, I would tell my 80-year-old patient, you know, who has maybe like a history of COPD or sometimes a respiratory issue, please stay home. Like, please stay home. So I think just moving forward, like, I think the APTA or somebody needs to do something better with creating some kinds of guidelines for people in my situation, because they made physical therapists essential employees. And since I don't work in a hospital, like I said, I work in an outpatient clinic, they could have just kind of triaged everyone that definitely needs physical therapy, those post-surgical patients, into one clinic and have them seen there one at a time. And I think that would have been much better for everyone. But obviously they're just kind of I'm not saying anyone's doing anything wrong. I'm saying nobody knows what to do because there's no guidelines in place. So I think I would, you know, like I said, look for some better guidance in the future. And do you know what the APTA is? It's just the body here that, yeah.
Yes.
Okay.
So do they treat physical therapists as all other doctors in US?
Absolutely not. No. I mean, I would say people that own their own kind of cash practices are, you know, that's when the patients are coming in, and, you know, a lot of times they're not using insurance, so they have like a high regard. Not that people don't have a high regard for me, but like they are like, oh, hey, doctor, whatever, I'm here for my physical therapy. I think in these kinds of outpatient clinics as they exist today, with kind of this antiquated model of seeing, you know, 3 or 4 or having sometimes 5 patients in the clinic at once, And, you know, just like I said to you about someone asking me if I even have, like, if I even went to college for this, I think it's lost on people, like, how much education we have. But, you know, I think in different settings, like I said, like a cash practice, where people are literally putting their hands in their pockets and paying money, and, you know, maybe they'll get reimbursed, maybe they won't. It's a different service. It's a one-on-one. It's, you know, checking in with people. So it's just a little bit different from the situation that I'm in. I have tried to kind of have a cash practice out of the CrossFit gym that I was going to. And it's just very difficult for people to, you know, want to pay money. Look, they might get reimbursed from insurance, they might not, but it's just, I mean, it's a hard sell. It is still for people, because I just don't think they understand the value. So I would say it depends. For our PTs looked at as doctors, it depends on the setting.
Yeah, even today in the quarantine time, physical therapists are doing telehealth and all, but people are not ready to pay on telehealth and all.
No. And I don't think they understand, like, how telehealth can even help them. But to me, like, my clinic isn't set up for telehealth that I work for, but so much of what I do is patient education. Like, I mean, putting, you know, e-stim is great, heat is great, you know, soft tissue, instrument assisted, dry needling, all fantastic tools, but it just still connects the person to me. Like, I'm going to give you the tools you need so that you don't need me. Like, that's the whole point, right? So you can tell, you know, all your friends, like, oh, look what Genevieve taught me, and I feel so much better. Like, you know, and then they can, you know, I might lose them because I make them better, but, you know, there's 5 people in line behind them. So I just feel like there is a lot of value to telehealth, but, you know, a lot of people still come in and they want those passive modalities. They want soft tissue, they want traction, they want all this stuff that it's like, you just need to, like, not sit like this all day. You know what I mean? It's like, people are sometimes their own worst enemies.
So, Dr. Genevieve, behind all this, who has been your inspiration and why?
I honestly, I can't say that I have anyone, like, you know, therapist or mentor or that I can really pinpoint exactly. I think everyone in my life, like, you know, I keep a very small, tight circle of friends and family. And I think, you know, my family and, you know, my boyfriend and my friends that, you know, or even moms, like a lot of my friends are new moms, like, that inspire me. It's those people in my life are kind of who give me my inspiration to, you know, keep asking questions and keep trying to do good, and just, you know, trying to do the right thing by, like, my patients and, you know, as a friend, as a partner, as a daughter. So yeah, so I think just the people that are closest to me in my life.
So, one advice that you would give to all the physical therapists around the world to be successful?
I gotta be honest, I would say think long and hard about what you're giving up to have this career, because the return on investment is not great. You might not have the respect coming out of school or the paycheck that you're expecting. But if you are passionate about helping people and you love people, and you know, because you gotta like people, okay? Because it doesn't work if you don't. And I think if you find a niche for yourself and you find a population that really inspires you, whether it be maybe pelvic floor health, pediatrics, sports, geriatrics, and because, you know, not everybody is going to be nice to you. Like, I mean, you know, sometimes I feel like I'm people's punching bags. They're in pain. They come in, they see me. You just got to really, I think you just got to really want it, and you just got to really like people. And it's just kind of it takes a lot of, I think it takes a really special person to be a physical therapist. I don't